Dear colleague, good morning. I am here with my friend and colleague, Professor Paolo Arduino, who is a professor of oral pathology at the university here in Turin. And we are making this video in English because we would like to share with you our experience in Italy, because as you know, now Italy, it is quite hard bitten by the coronavirus. And so we would like to share with you all the attention and all the guidelines that we are following here in Italy for the dental practice. Yesterday we did the same video in Italian and we had more than 10,000 viewers. So I think that it is very, very interesting because it's not very long, but it's very, very important to share these guidelines. Also because today there are just 2 articles published on the international literature. So we will follow their guidelines and Paolo will speak briefly about this kind of virus, and after I will give you the guidelines to follow in our dental practice.
Thank you, Michele. Thanks for the invitation. And yes, we are now here talking about something that even if we try to imagine 6 months ago, it seems impossible. I'm going to share with you some very brief information about this type of disease and what does it mean in terms of general involvement. We are talking about virus infections which spread approximately in the middle of December of 2011 when the first atypical cases of lung in-infection have been described in a particular region of the China Republic. At the middle of January, the WHO called the virus responsible of this disease 2019 new coronavirus. And on January the 3rd, the WHO announced that the case described was just an epidemic infection and a very huge international emergency. On February the 11th, the WHO called the disease caused by this particular type of virus COVID-19, which means coronavirus disease 2019. And on the same day, the international group of the study for the taxonomy of the viruses renamed this virus as SARS coronavirus 2. Just remember, in the cases of SARS that developed in China in 2002. Actually, it is a virus, it's a beta coronavirus, and the coronavirus are not new virus. They've been described for the first time in 1966, and actually they are quite responsible for different type of cold, flu, just a normal illness, which is absolutely normal in our region in the January, February and March. But there are 3 types of this beta coronavirus, which can spread from animal to human, and they are the SARS virus, the MERS virus, and the new one, the coronavirus 2 SARS infection. It is a quite struggling disease because the mortality actually nowadays we suggest that it's about the 30% of the infected cases, but naturally the epidemiological cases are naturally increasing. Please remember, we are talking about about a virus that has been discovered in less than 2 months ago. So it's new. It's new for everyone. It's new for every medical practitioner. It's new for epidemiologists. It's new for internal medicine. It's new for virology. And this is a thing that I really care about it. Please be aware or where you get the information when you're talking about this virus, especially for people, colleagues that are quite keen in social networks, Facebook, Twitter, and so on. Please be aware from where you take the information of this virus. I suggest you to pick the information only from institutional sites, National Ministry of Health, the WHO site, the website, just because it's now it's been very diffused to spread fake news, and this can be very dangerous for the population instead. It's very similar from this type of disease is very similar from the two previous that I already talked about, the SARS infection in 2002 in China, and the MERS infection which spread in 2012, if I can recall exactly, in the Middle East. It seems that the mortality rates of this new SARS-CoV-2 infection is quite lower than the previous one. But the problem is that the virus seems to spread more strongly. So, in terms of practical numbers, there are more people infected, but unfortunately the mortality rate, it seems to be still low, and it affects about 2-3% of the total cases. It has been shown that the human receptor for SARS-CoV-2 virus 2 is the ACE2 receptor, the angiotensin converting enzyme, which normally are present in the lung of the people. The virus binds this particular receptor, and so it can affect the lung of the people. The most reported symptoms actually are fever in about 98% of the total cases, and cough in about 75% of the total cases. The most feared complication is the distress syndrome, the respiratory distress syndrome. It seems the mortality rate is quite higher in the older people, more than 75 years old, more in male patients, and also the affected cases are usually middle to late age. It seems very not prompt to cause infection in child or person below the age of 10. Actually, there is no therapy at all. The only therapy is today, the best therapy is the prevention of the spread of the virus, and so the control of the propagation of the virus. Probably we will be able to have a vaccine in about 1 to 2 years, and so it's absolutely mandatory in this particular moment to control the propagation of the virus. And so, what are the general protection measures? The usual one for every kind of this type of infection: increase personal hygiene measures, wear medical or surgical mask, rest and stay at home, and keep rooms well ventilated. It is actually a very medical problem, and just because there is no cure at the moment, the only way is to prevent contact. And we, as dentists, are absolutely one of the medical person which is in first line, and so we have to maintain some kind of particular attention, which one now Michele is going to tell you.
Thank you, Paolo, and I totally, of course, agree with him, and we have to pay attention, especially, we will see, for droplet and airborne spread. of this virus. So what we can do in our dental practice? And first of all, we have to think about which are the possible way of transmission of this virus in the dental practice. First is airborne spread, because usually we make a lot of we make a lot of airborne, so we have to reduce as much as possible aerosol and droplets.
Many more than any other medical practitioner, because in the dental practice, I mean,
absolutely. Then the direct contact with blood and oral or human fluids, in our case, of course, oral fluids. Then to cover, we will see also, we will repeat also it after, the contact spread, also because nasal mucosa, oral mucosa, and also eyes can be way the virus can get into our body. So also cover the eyes using every kind of masks that you have, but you have to pay very, very attention to prevent the spreading. And then, of course, the surface which can be contaminated around our chair, around our operative chair. And it has been described that the virus can resist from 2 hours to 9 days. Of course, losing its power, but however, it can remain there until 9 days. So, always to be clean, and it's better to keep a dry ambient, which means opening the window, making a large amount of air changing, and this is fundamentally. Then, the triage, I mean the patient evaluation, and about this we have to be very, very, very strict. And we have to make 4 questions, very clear. First, do you have or do you had fever more than 37.5 Celsius degrees in the last 14 days? Have you had cold? Did you have cough? Then, second, did you meet people with these problems in the last 14 days? Third, did you meet infected people in the last 14 days? And the last, are you coming from a risky area outside your country? For example, like Italy? If the patient answers yes, just to one of these questions, or when he gets in, we have to register, we are registering the fever with the contactless instruments to register if they have got fever. In that moment, the patient must be sent at home, and eventually we have to advise him to be in contact with the local health department. Because if he or she will have different problems, he will make under control by the local health department. Then we have to use, following the Chinese guidelines, the hands hygiene very, very, very strictly. Doctors from Wuhan, they suggested us to use the guideline 2+3. What does it mean? It means that we have to wash 2 times the hands before and during the operation, and then we have to wash them 3 times after the operation. And in particular, we have to wash our hands before the patient examination. Then, after the examination, we have to wash our hands before dental procedures. Then, when we finish the dental procedures, we have to wash our hands after touching the patient. Then, we clean every surface, so we have to wash our hands after that we have touched all the surrounding surface, and eventually one more washing hand. Of course, in every passage, we have to change the clothes. Otherwise, we will reproduce the virus every time. What about personal protective measures? We must use every suite, which must be a surgical suite, of course, and we have to change it for every patient, and we have to use disposable working cap, surgical mask, working clothes, face shield, covering also the eyes, and the disposable gloves, and we have to change them, this must be clear, for every patient. What about mouth rise? Before doing every examination or every dental practice, we have to make patient wash his mouth, but it is not very clear, and it seems that chlorhexidine doesn't have any possibility to reduce the virus. What they suggest is the 1% hydroxyl peroxide or 2% povidone. These up today are the only two mouth rise who seems to be effective against the coronavirus. Then, what about what we can do? We have to clarify that with our patient we don't have to make prosthesis, we don't have to make cosmetic dentistry, we don't have to make restorative dentistry, or
hygiene.
Or hygiene, exactly. But we must just do the emergency. Which are the emergencies? Are the treatments of the infection. So, for abscess, opening one tooth if there is a pulpitis or if there is an infection, eventually extract the tooth, and that's all. We must not do every other thing. The rubber dam isolation, of course, is always mandatory and is more mandatory nowadays. First of all, we have to explain, and we didn't speak about it before, which are the emergencies that we have to treat, but we have to treat only them. Also, if in your country you don't have these strict rules that we are following now in Italy, you have to prepare yourself and prepare your entourage that probably you will have the same things that is happening now in Italy. So please just make eventually the emergency tooth extraction, emergency infection solving, and eventually if the patient has got pain, open make the pulpectomy. But that's all. You have to use the rubber dam isolation, but remembering always to use at least 2 suction, and if it's possible, 1 extra volume suction. This just to catch all the possible aerosol.
Or if it's possible, you better prefer manual instrument instead of usually.
I mean, if you want to open or if you want to start the endodontic treatment, you can go also without any spray, just placing some water, and then you can go with manual instruments, manual curettes or manual scaler and so on. What about the end piece? End piece are recommended to use only the one with the anti-retraction, because it has been demonstrated that this virus, without this device, can go inside our chair, inside the water connection, and so can stay there for 9 days. So anti-retraction end piece. And disinfection of the clinic settings. Of course, we spoke before, where you have got open the windows, because I know that, for example, in US, some skyscrapers are without windows, so it's better not to do anything. And please disinfect every surface. But every surface means the door, the door handles, the chairs, the desks, also the elevator. And it's recommended if people have to go inside the elevator, please give them the mask before going inside the elevator. And you have to clean all the surface with the solution, alcoholic solution, at 70%. These are, until today, the guidelines that we are following in Italy, that we suggest you. And we, with Paolo, if there will be news from Italy, news for treatment or news for prevention, of course, we will upload with new videos on our channel. And until now, thank you for your attention and take care of you and of your patient.
Bye bye.
Bye.